What I'm going to be talking about is the issue of outcomes-based funding and the role of client outcomes in this new contracting approach. Just before we get into that in any detail, one of the important things to remember is that this is an outcomes-based funding system in which it's your prospective outcomes and the demonstration of what you will do that will get you a contract. It's not a performance-based system. So it's not a system in which you have to create the outcomes and then you get funding. So just to make that important distinction before we start. The role of outcomes, client outcomes, has been an important feature of the government's current program, the Delivering Community Services and Partnership Policy. And as that phrase suggests, it is a partnership approach between the community service sector and the government. And in terms of this funding approach, it's a question of both the community sector and funders getting together, and this is the ideal, getting together and talking about the outcomes that are going to be important in the sector that's relevant. So working through a set of outcomes together so that we have a system which reacts to those that are working on the ground. So ideally, contracts should be developed with outcomes being developed from the ground up in partnership between the funders and those who are providing services. And I know that in a number of departments we're seeing some of that occur at the moment, those partnership forums in which services are coming along and talking to funders. So we want to see more of that. And I suppose this process that we're looking at here is part of that, where we're trying to work with services, inform them of the developments and get their feedback as well and feed that back into funders. So the essence of what we're looking at is really this, that there is a set of outcomes that you're trying to deliver based around the activities that you put in place. And those outcomes are being delivered and being provided by you in tender documents at a particular price. So really what we call a value proposition is the outcomes that you can deliver, and at the tender stage it's what you can demonstrate through evidence that you may deliver relative to the price that the government's going to pay for the services, and that's the value proposition. Outcome relative to price, and that's a very much an economic type of proposition, of course, because what it's saying is it depends on both sides. It depends on the outcomes that you're going to produce, that you say you're going to produce and that you have evidence for, relative to the price that's being paid. You can have the best outcomes in the world, but if the price is too high relative to budget, that's the funder's budget, then you have a problem. And that's a difficult process that you have to work through, and that's where the issue around costing and price is so important. This new contracting system does have a focus on ensuring that all costs are specified, but at the end of the day there's also a fixed budget, and it's impossible to get around that basic economic principle. So later we're going to talk about the issue of the costing of your activities, the pricing of your product, but for now we're focusing on the outcome side of it. So in essence, this is a deal between the funder and the provider. And so the context is you're delivering outcomes. It's no longer you're delivering outputs. You're not delivering a certain number of clients. You're not delivering a certain number of sessions anymore. The funder is not paying for sessions and for clients. What they're paying for is a service that produces outcomes. And that is a very significant change. So what they're interested in is contracting to services that can produce those outcomes. And I think there's really 3 steps to contract here. One is it's an internal process for you as a provider. You have to think through what are the key outcomes that you're trying to deliver for clients, what does success mean for the people that you're working with? What does it mean to have a good outcome? And develop internally your own thinking around outcomes. Now, it's important to develop that thinking because then you're in a better position to react when documentation comes and you're reacting to that documentation around outcomes. Because down the track, after the consultation process, there will be a point in which documentation will present a range of outcomes that are being trying to be achieved at the system level. But if you haven't done your own thinking, you're going to be in a reactive position rather than a proactive position. When you've done your own thinking around outcomes and you've structured your model, then you can be in a better position to react to the documentation that comes your way. A good example of that is where you've set a range of outcomes. They're not actually in the final documentation, but you know that those outcomes are necessary in order to achieve the outcomes that are specified. And by you thinking through that, you're in a better position than you would otherwise be. So the first step is for you to think through your own outcomes, the outcomes that you're trying to achieve for your clients. What does success mean for your clients or the people that you're working with? The second step to contract is the question of developing your model, your service delivery model, in which you're working out how you're going to achieve those outcomes. So it's one thing to say, I will achieve X, Y, and Z. But it's another thing to say, I will achieve X, Y, and Z because I've got these activities in place and I've got good evidence to suggest that these activities with my engagement strategies are best placed to produce the outcomes that we want to achieve. So that's if you like, the mechanism, the transmission mechanism that you have to work through that takes you from the money you get, the inputs that you have available, through to your activities, your engagement strategies, through to your outputs, as we're going to call them soon, and then finally through to the achievement of client outcomes. And the final step is you're putting your outcomes together with your price, and you've done a lot of work, and we're going to go through that later, in terms of specifying costs and price. You put your outcomes relative to price, and you are putting forward a value proposition about the outcomes you're going to get relative to the price you're paying. So I think there are 3 steps to contract. Now, the first step is defining your intended client outcomes, recognizing that a little further down the track, you will need to moderate this in terms of the actual outcomes that are specified on paper in funding documents that you're reacting to. I've talked to a number of people about whether they should be working through their own model now or just simply wait. You know, why work through my model now? Why think about my outcomes now when I'm just going to see a document which will have a range of outcomes that are different to mine? I think that's not good thinking. I think that's very reactive type of thinking. I think what you need to do is really think through your own model straight away, because it's just around the corner for some and 6 months for others. Think through your own model so you're in a better position, you know what you're about, and then you're in a better position to react to what you see. So I think it's really important to do that. So let's just look at that first step. You know, what would success look for the clients that you work with? And think about them, and you're thinking about what you can achieve for them. So that's the underpinning point. There are, of course, other people in the system. It's not just the clients. You've got your workers, you've got yourself, you've got managers and so on. You've got the families of those who are your clients. They're all important, and they will feed into the final result. If you don't have a good workforce, you're not going to have a productive and happy workforce that will continue to stay with you, and therefore you'll get lower client outcomes. So part of the story is, well, you're going to have a human resource management process as part of your model of achieving outcomes. But let's just focus on the outcomes first. And what we want to do is distinguish between the different stages. So the focus is on outcomes, but there are a lot of stages before that. And we're going to present what's called a program logic model, which will enable us to carefully think through all the different stages and distinguish outcomes from other parts of the system, in particular outputs, because we often see the conflation of those two factors. So first of all, establish what you're about as a service. Ground yourself first. Determine your own set of values and priorities. Look at the needs that face you. Look at the client group that you're working with, and set down an agenda about what you want to achieve for your clients. Now, I think it's very, very important to be aware of the needs and backgrounds of your clients. We'll get to that later on, because different client groups will have different needs, and those needs will affect outcomes. And it's going to be very important that you really let your funders know what the background of your clients is, because outcomes will differ according to background and history. And you've got to make sure that you're being measured against the right benchmark. So after setting out your own agenda, you've got to think about where funders are coming from. Funders may come in with a shorter set of objectives, a more narrow set of objectives, or even a wider set of outcomes than you'd thought about. So you have to be in a position to react to that. It is a partnership model, so we should be seeing interaction. If you don't see interaction between yourselves and your funders now or in the next few months, then that partnership model is breaking down around the specification of outcomes. Now, let's get on to understanding the different stages. What are the different stages involved? And how do we distinguish outcomes from other stages in the process? Because this is important. The issue of what is an outcome sounds pretty simple, but it is in fact a point of confusion often. And I'm still seeing in documentation from funders outputs being messed in with outcomes. So we really want to get this one clear. And what we're going to do now is have a look at what's called program logic. The logic model sounds complicated, but it isn't. It's just a way of classifying the system, the process. And the big distinction is between your planned work and the elements that go into your planned work and your intended result. The outcomes world is part of your intended result. Your planned activities, that's where all your resources are, where your plans around activities are, where your outputs are. And so this contracting world is in the intended result area, and it's around outcomes. Now, there are three main elements of your planned work. First of all, you need money and you need inputs in order to generate your activities. And that's what you're going to funders for. You're going to funders for resources. It's a good idea to think widely. There is no reason to restrict yourself to government funders. Supplement that funding with other sources. We're not seeing governments now, like we often did previously, or government departments rather, where if you're successful getting money from outside, you're less successful getting funding from the government because you don't need it. I think there is a recognition that if you go off and do your own good work and get in extra resources, then good for you. That means that the government, when they're funding you, can leverage off that. So you have resources. You then plan your activities. And those activities should be linked, as we're going to talk about later, to your intended results in terms of outcomes. There should be a lot of thinking around this. And the phrase that is used is theory of change. What is your theory of change? How are your activities going to generate the desired outcomes? What is the link between what you do and what you're trying to achieve? And for every activity, you should be trying to work out the link to your final outcomes. And it's really important to draw this and to think through it and conceptualize it and to work through iterations of, so I do this, if I do this, then I get this outcome, that will then lead to that outcome, etc. So, you've got to do this thinking, the chains of linkage. Now, when you put activities in place, you do not automatically get a range of people coming to you. They're all going to sit in those sessions. They're all going to do the work you think they're going to do. They're all going to be there producing something that's the desired result. There's a lot of engagement that you have to do. So you've got activities, and just as important as activities is participation and engagement. So you put things in place, you have engagement and participation strategies, and out of those two things, you get what I call the outputs. And the outputs are, for example, the number of children you have at your childcare centre, the number of sessions and hours you do. These are the outputs. So they're the measures in terms of numbers of what you do. And that's what's called an output. Now, in the past, there was a lot of emphasis on outputs. So how many children did you have, for example, through your childcare centre? How many clients did you have in your housing service? How many clients did you see in your counselling service? So that's the world of outputs. How many sessions, how many people, how many clients, and so on. That's the starting point, though, for an outcomes-based system, because what we want to know is what was the outcome that was achieved. And we distinguish between relatively short-term outcomes, medium-term outcomes, and longer-term outcomes, and also final impacts. And impacts has both a time dimension, long-term down the track, and it has a community dimension. So, for example, if you're working with unemployed youth in a particular region, the impact at the community level could be a change in the unemployment rate. That is a widespread community impact. The long-term individual impact may be 2 years down the track, this person has in fact gained employment after doing some training and linking in with employers. So it's very important to distinguish these elements. So we're going to present this within a very simple program logic model. As indicated here, a logic model is a systematic and visual way to present and share your understanding of the relationships among the resources you have to operate your program, the activities you plan, and the changes or results you hope to achieve. So it's a systematic representation of the relationship. And I've suggested 2 sites here, and one of the activities I got later is from one of those sites. So they're really important to go to. One's called the Kellogg Foundation site, and there's a couple of manuals on program logic. Take them back to your staff and work through some of that work in those manuals. There's also the University of Wisconsin Extension website, which has a heap of material, specially designed for people who haven't had the background in this area to sit down and work through and think through these ideas. You can play around with different visual representations of a logic model. There's many of them. There's PowerPoint slides to download. It's just a wonderful site to get material. Let's look at, this is the simplest possible representation. So refer to the slide on step 1 outcomes here. Simplest possible representation of a logic model in which we go from inputs to activities, outputs, outcomes, and impacts. We probably should have put in participation and engagement there, which we will later. But it's pretty important. So the first set are your planned work. The second set are your intended results, and the focus of the WA procurement process is in relation to the outcomes and impacts area, what you're trying to achieve. And really what we have in a logic model are a series of if-then statements. So if we have the resources, and you have to ask that, what resources will you need to achieve your intended result? What resources will I need? And are the resources that I'm going to get from government through a competitive process enough? Probably not, generally. So what resources do I need? to implement your set of activities. And so your activities are the things you are going to do. And so if you have these resources in place and you've got already a theory there of what resources I need to implement my activities, you've got some theory there in terms of what does practice, my own experience and what I read from the literature tell me about the best way of running particular activities. Then you've got engagement strategies, and if you're effective around those participation and engagement strategies, then you'll have a certain number of people attending your sessions, and that's your outputs. So if you have a good match between what you're doing in terms of engagement and your activities, then you will get people participating, and you will start seeing results. The outcomes then are the benefits of that, and what is achieved for those you work with. So an output is they attend a session. An outcome is they may learn, they may gain skills and knowledge. Further down the track, you can talk about the fact that they've got a better sense of well-being, they're surer within themselves, greater self-efficacy, higher resilience, and so on. They've got specific knowledge that they can take on. And then you're talking about behaviour changes and actual practice changes, if that was the purpose there. And then finally down the track, where are they some years on? What's happening at the community level? So that's the sort of process, and as we can see here in this diagram, which is referring to that link between your outputs right the way through to your impact, there are a range of elements, and we often distinguish between learning, the knowledge, skills, motivations, and so on that we see, and actions. What actually do you do? So what goes on in the head of someone in terms of their knowledge and their skills and their behaviours and motivations, and then what they actually do in practice, and then finally what happens at the community level and what happens to that individual over time. So that's the program logic. Now, one really important point that I keep emphasising is, if we're talking about outcomes, what we're really referring to is differential effect. It's differences that you make. Now, that difference is often poorly measured. And what we often see is people, services, try and get some measure at the end of service provision about where the person is now, which is highly problematic if you think about it. So if outcomes are around differences that you make, the government and other funders are spending money. If you don't make a difference, then the money should be spent elsewhere. So what we're talking about in terms of outcomes is the difference you make to what would have happened otherwise. And that's the counterfactual. So something to think through and throw it up in a dinner party tonight. What you've got to look at is the counterfactual when you're talking about difference. So it's the difference you make against what would have happened otherwise. And this is a really, really difficult measurement task. And so don't be too concerned about, hang on, I actually don't know what that difference is. Well, it's really hard to measure, but it's really important to conceptualise. Let's give a couple of examples of why it's important to think about this. Those who work with, say, unemployed youth and unemployed people generally know very well that there are, in fact, really significant flows into unemployment. Large numbers move into unemployment. They move into it mostly, as it turns out, for very short time periods. So that when you look at those who are currently unemployed at any given point in time, a lot of them are unemployed for a period of time. They've been unemployed for some time. But in fact, what you're looking at is a continual flow of people into unemployment for a couple of days, a week maybe, and they get out pretty well straight away. If you added up that number each year, it'd be a huge number. It's much larger than the actual stock of unemployment at any given point in time. And why is that? Because they move out straight away. And let's think about that from this point of view of the counterfactual and difference you're making. For those people who are going to move out virtually straight away, any sort of support is meaningless. It is a waste of money. It is diverting from other sources. It's probably diverting them from their task. So the difference you're making, if you work with those who are going to get out straight away into the jobs that were just around the corner for them, the difference you're making is a negative difference. Now, you might in fact be able to then go to your funder and say, look, I've got all these people employed. But because you were engaged in it, it took you longer than they would have, cost money, and it's a negative impact. So that's a really important lesson, that it's the difference against what would have happened otherwise. Now take the same example and think about those who become unemployed and have a high risk, high probability of not getting that job, of staying in unemployment for long periods of time and having very adverse psychological, social and economic consequences of that unemployment. If you don't intervene early for them, consequence is very long-term unemployment and these very adverse effects. So the difference you're making now when you're intervening with them is a really positive difference often, and it's against the track that they were going to follow. So what we're trying to get at is the difference against what would have happened otherwise. And that's the outcome that we're trying to measure, and that's a really difficult one. And it's important in this context to remember that different client groups have different needs and backgrounds. And so that client group in which there are going to be long-term impacts, they've had a long history of suffering and difficulty, the outcomes that you're going to see typically are going to be smaller and in a smaller proportion of that group than if you had another group which was lower needs and so on. So that's important for funders to know about, because in an outcomes-based system, what tends to happen is that those services that get the low-hanging fruit, those with lower needs, look as though they're producing better outcomes, when in fact they're not necessarily at all, and therefore achieve higher funding. And funders and services need to understand the background of and histories of the clients that they're working with, because that's going to be important to work out the difference. So to make the point again, it's the difference you make against what would have happened otherwise that is so important. Right, so let's just park that one for a little while and do a quick little test. So what we want to do now is just check that we've got the lingo right in terms of outcomes and inputs. All I want you to do is just read through these examples and allocate whether this is an input, an output, an outcome to each of these examples. And we're going to do it in terms of a little test for you. So if you're sitting there in the service and you're watching this, we want you to sit down and try out this little test. See how you go. Allocate a number to each of these items, whether it's an input, whether it's an output, whether it's an outcome or an impact, just to make sure that we've got that distinction right. Okay, let's go. Right, let's see how you've done. So let's just go through some examples. First of all, teens learned leadership skills. What's that going to be? Listed down there is an outcome. So learning leadership skills, it's the first stage of an outcome, knowledge, learning, and so on. Let's have a look at another one. Training programs included seminars and workshops. What's that? An output. That's what you do. It's not the change that you get in clients, it's what they actually do. It's what you're doing. It's the activities, the engagement of clients producing outputs. Let's have a look at another one. Youth serving agencies have increased their collaboration. Now this is an interesting one. This is one in which there is a little bit of a difference between people in terms of how they see this. This is what I regard as a good outcome at the service level. Typically a good outcome. Service integration is something that this present government and most agencies are really trying to support. Most services are trying to support. They recognise that with people with different needs, you need to be collaborating between different services and getting networks going and so on. So service integration is a big thing. For services, it's an important outcome. To me, it is an activity really ultimately a means to an end. If the focus is always going to be on the client and their outcomes, it's a means to an end. But that's one area where you will get difference. I tend to put that back a step in terms of means to an end rather than an end for clients themselves. Let's have a look at another one. Teens learn to counsel other teens on tobacco prevention. Yeah, that's an outcome. That's where the teenagers are actually, if you like, delivering their own knowledge to others. So we can see that there are, for most cases, we know exactly what's an input, what's an activity, what's an output, what's an outcome. In certain cases, like the service integration case, where I see it as a means to an end and not an end itself, some people are seeing it as an outcome. I see it as a means to an end. But funders typically are seeing it as an outcome, so just remember that. Now let's have a look at the next stage of this. So we've understood program logic and the distinction between inputs, activities, outputs, outcomes, and impacts. The next stage of this is really important, and I think it's the one that's typically forgotten. So once you've said, okay, I know what I want to achieve for clients, I've talked to them and I know what success means for them, and I can see the outcomes listed. There's a big missing gap here, which is, so how are you going to achieve these outcomes? What's your transmission mechanism? If you put your activities in place, how will you get the outcomes that you're after? What's your theory of change is what this is about. So the language on this is what's your theory of change that takes you from your activities to the outcomes for clients. It's how and why questions, big how and why questions. How and why will your service achieve those intended outcomes? What links your activities to those outcomes? Now, funders, in the end, can't be ultimately convinced by statements which say, these outcomes I'm going to achieve. If you fund me, I will get good outcomes. There's a big missing gap here, and that is, so how are you going to achieve these outcomes? What is it that lies behind your service that gives me confidence that you can achieve the outcomes that I'm after for the client group that you have? And that is really about the demonstration of impact. So the theory of change is your specification of how you're going to take your clients from one place to another, through what activities, what is the evidence base for this, what's the theory that lies behind it, and what is going to convince the funders that your service delivery model will achieve those outcomes. So you can think about this as moving forwards or backwards. You've got inputs, you've got activities. Going forwards, if you have those activities in place, then how are you going to achieve the outcomes that you're after? Going backwards is quite an interesting exercise because you might pick up on a few things. Specify the outcomes that you're trying to achieve first. What is it that you're trying to get at? And then go backwards. So if that's what I want to get, how am I going to do it? What things am I going to put in place to achieve those particular outcomes? So I think that this process is a forwards process and a backwards process, and do the two together, And I think you have a pretty rich type of environment. So combine the forward-looking and the backward-looking together. Say, going from the beginning, how do I get the outcomes? From the outcomes, what do I have to put in place to get them? So that gets us finally to the value proposition. And it's about why you should be funded. And why you should be funded is really about the outcomes that you're going to achieve for funders relative to price. But lying behind that is some sort of demonstration that your service is worthwhile, that your service delivery model is best placed, is capable of achieving those outcomes. And that's around evidence. So what you need to do is use your existing evidence, use your practice knowledge, use the data that you're collecting on clients and the data that you're collecting on outcomes to tell an important story that has strong foundations, that has an evidence base, and that can convince funders that your service delivery model is best placed to do this work. So it's really about getting together good data collection systems, good thinking around service delivery models, good evidence, good analytical work, good evaluation work. And that doesn't mean going off to a consultant and getting a consultant to do an evaluation for you. It means you doing a lot of thinking yourself around what you're achieving in this place. Now, really important here is the role of evidence. And this is where the system that we're looking at, the changes that we're looking at, have certain divergent elements to it. So we're trying to reduce red tape. We're trying to put less pressure on services. But I can tell you, if you go into an outcomes-based world, whatever you're gaining in terms of reduced red tape, you have to put on in terms of increased data collection and increased thinking and analysis of data. So there is nothing in this system that we're seeing that suggests to me that we're reducing the burden on services. And it's ridiculous to think that. If you go to an outcomes-based world, you put extra pressures on services. So what we're seeing is that we hopefully are getting a lot of savings in certain areas, such as, you know, you're having to do 15 contracts when you could have done 2. Now that should produce savings. But ultimately, if you go to an outcomes-based world, you're increasing certain costs. And that has to be borne in mind. Now, the big cost that you're increasing, and it's a good cost, it's going to make more effective services ultimately, is you're having to get services to think more and more about what they do and what they deliver and how they do it, why they do it, their theory of change, the data they're collecting. And one important thing to think through is, so you've got these outcomes that you're trying to achieve. Now tell me your measures for those outcomes, and tell me what your data tells you about those outcomes. Now, in asking that question, most services will probably say, help, you know, I'm trying to achieve these outcomes. I've never really had to deliver in terms of evidence on a lot of these outcomes, but I know that this is what I'm trying to do. I don't actually have the data collection system in place. I'm not even sure what precise measures I will use. So to me, there's quite a lot of work developing this. Now, part of this work should be about program funders and what they're doing. We hopefully can see more work being done by funders in developing data collection systems that can be used by everyone in the system. But I can assure you that I think a lot of this is going to come down to the services developing further work themselves in the outcome space. So if you don't have those outcome measures in place, you haven't developed the evidence that backs your case as to why your service should be funded. There's a bit of work to do here. And that's probably the biggest message, that once you work out your model And the activities that we're presenting on the slides following will show that. Once you've worked your model through and have sat down and understood your service delivery system, you're going to have to think about measures of outcomes and the data you need to measure outcomes. And that's a big piece of work coming up. So let's just end here with what I regard as the extended logic model. This is a nice diagram from the University of Wisconsin website, and I suggest you go there and start getting some of those materials from that site and use them in your service to think through program logic and outcomes and activities. But what we've got here is a diagram which says the first thing that we need to work through as a service is our own priorities, our own values. What we're about as a service. Importantly, we don't stop there. It's impact over intention. This is one of the big slogans of the modern era, if you like, impact over intention. Okay, we're really interested in your intention and the values you bring, but what we want to see is your impact. And we're probably going to put more emphasis on what you do rather than what you say. But the values and priorities that you have as a service do frame the work you're going to do. Then you've got to set out your logic model. And here we've listed down the inputs ranging from staff, time, money, and so on, to outputs, and we're dividing that between activities and participation. So it's just a different representation of that logic model. You'll see a number of them around. The activities are the planned things that you have in place, you know, workshops, sessions, etc., products, curriculum, whatever it is. Participation is how you get the clients engaged, how you get them there in the first place, and how you get them engaged and being participative in the activities that are in place, and having a process where they can feed back and really impact on what you do. Then you've actually got the numbers of sessions and the number of people, and we get to outcomes. And as you can see here, we're dividing between short-term outcomes and using that word learning, about awareness, about knowledge, about attitudes, skills, and so on. And then we're looking at more medium-term results in terms of action and their practice, what you actually see that they do, and then longer-term impacts both for them and for the community that you're working in. There's a lot of emphasis on these longer-term impacts for good reason, because that's what we're trying to do, achieve longer-term change. As to measures, now that's really difficult, and very, very, very few services have measures in place that enable them to say, okay, on exit, 6 months down the track, what do we see? This is a really difficult area. So some of this may be about your built-up practice and what you put down in your own service notes over time, your contacts. There is obviously a really important need for you to develop a very good baseline. You know, where were people at when they entered? What was a bit of their history, so we know something about where they came from, and then how they changed over time. And so you have baseline and continual measurement and final exit. But longer term impacts, that's something that most services don't have, but I think it's really important. Okay, now it's your turn, and what we want to do is, first of all, for you to have a look at your specified program, where we want to list some of your inputs, what activities you put in place, the outputs and how you measure them, and then finally intended outcomes, and list short-term and medium-term, long-term outcomes, and then potential further down the track impacts on both clients and community. And very importantly, when you come to the outcomes, what we want you to do is list ways in which you're going to measure those outcomes. So if you say improved well-being, well, what's your measure of improved well-being? If you say improvement in terms of drug dependence, what's your measure of that? If you're going to say greater stability, greater engagement, what's your measure of that? And so try and force yourself into thinking, you know, what are my measures and how am I going to present my evidence? So that's the activity number 1. Activity number 2 is that we want you to think through your theory of change. So going from one step to the next, what is it that links up your steps? What is your theory and evidence that lies behind you putting forward activities and generating the outcomes that you desire? Okay, so it's all over to you now.